Okay, next I'm very happy to introduce Dr. Sharlene Greenwood. Sharlene is a consultant physiotherapist and senior lecturer in renal and exercise rehabilitation at King's College, London, leads several research projects looking at kidney and heart disease and physical activity, and is going to give us a talk on lifestyle and kidney disease. Thanks very much.
Okay, so thank you very much for inviting me along. It's a real pleasure to be here today to come and talk to you about my favourite subject, which is lifestyle. And so what is it that we're going to talk about today? So before I mention that, I'm going to get everybody to stand up, okay? Because that's partly because I'm a physio, but there's also something behind that as well. So everyone just stand up. I'm going to stay standing up for a second, or 2 or 3 or 4 or 5. Good, okay. All right. Well, can anybody tell me why I'm asking you to stand up? Anybody know why?
Is it healthier for you?
Yeah, healthier. You've probably all seen in the press, haven't you, that if you people are having meetings now, standing up, partly because it gets the meetings done quicker, but it's also healthier for us to be standing up. Any other reasons? Concentration. So I want you to be able to concentrate. You've already been sitting down for an hour, so I want you to be able to concentrate. There was another one. Yeah, absolutely. Your circulation, lovely. There's also been some good studies which have been done which shows that you burn calories just by standing up. So as we've been standing here now, we've all burnt a calorie. So that's worth it. Might not help if you have a biscuit in your break, but it all counts and it's all worth it. Okay, everyone have a seat. Lovely, thank you. So hopefully you're all feeling a bit more energetic now. So what is it that I'm going to talk about today? So we're going to talk about exercise or physical activity, and there is a difference between the two, and I'm going to quickly tell you what they are. So physical activity, any bodily type of movement, so gardening, walking, all those types of things. Exercise, more structured activity, so organised, rhythmical, structured activity of the body. Okay, so those two kind of get interchanged, and I'll be interchanging them a little bit as well. So I'm here to talk to you about exercise and lifestyle and why it's important, especially if you've got some problems with your kidneys. What I'm not going to talk to you about and get you to do is to look like that, because nobody really wants to look like that, and it's practically impossible to look like that. Okay, so what is it that we're going to talk about? We're going to talk about the importance of lifestyle and the kidney. So we'll talk a little bit about why we need to do this, what's happening with the kidney in the body. Going to talk about recommendations. So what are the recommendations out there for people who've got kidney disease to do exercise and physical activity? And then I'm going to talk through some of the exercise and physical activity options. So things that are available, things that you might want to do, and things that you've got a choice of taking part in. And why am I the best person to be here to talk to you about this? Well, I've been a physio now looking after patients with kidney disease for coming up 17, nearly 18 years. So over the time, I've been encouraging patients to exercise and also looking after people who are overweight. And what I've hopefully picked up are some good tips, which I can hopefully share with you today. Okay, so what is it about kidney disease and the body that we need to know about? So John just in a really lovely and succinct way, talked to us about what happens with IgA nephropathy and kidney disease. I'm going to talk a little bit more generally and say that when we've got kidney problems and our kidneys stop working so well, there are certain things that happen in the body. One of those is muscle wasting. Okay, so that happens as we get older anyway. So people might have heard of the term sarcopenia, and that's age-related muscle wasting. It also happens when we don't use our muscles. So if we sit too much, hence standing up, get moving. So if we sit too much and we don't use our muscles, they get smaller. But also to do with the kidneys not working so well, John mentioned this inflammation and also build-up of toxins, and that can also damage the muscle fibers and make the muscles work a little bit less than what we would like them to do. Bone density, okay, so again, the kidneys, they balance those important minerals, and because the kidneys might not be working as well, sometimes some people can start to develop problems with their bone density. Fatigue, okay, so fatigue, that can be physical fatigue, so feeling lethargic, Also mental fatigue, lack of motivation. These are all things which people say are quite common. Some of my patients tell me are quite common in kidney disease. And then also cardiovascular disease risk. So we were talking about blood pressure. So blood pressure is one of the big things which is affected with kidney disease. So we get higher blood pressure. This increases the risk of getting cardiovascular disease. Okay, so we need to look at ways that we can help to reduce that risk. So why is it that inactivity makes you feel worse? Okay, so I'm going to start at the top there and say you feel breathless and unfit. So because you feel breathless and unfit, you do less activity. And because you do less activity, coming around the side here, let me try and get this pointed to work, your fitness level decreases. And as that decreases, your muscles get weaker, so not using your muscles. And then you get more breathless and more unfit, and we start this circle off again, so you do less, you get more unfit. Okay, so this is called the cycle of decline, and it affects everybody that doesn't use their muscles and get active. So this is where you've all got to, I'm glad I woke you all up, because this is where you've all got to get involved. Okay, so why exercise? What does exercise do?
Improves cardiovascular fitness.
Absolutely.
Builds muscles.
Builds up your muscles, makes them stronger. Lovely.
Pumps blood.
Pumps blood, so improves your circulation. Yep.
Bone strength.
Bone strength. Lovely. Yep.
Burns calories.
Burns calories. Absolutely, makes you feel better. Okay, you've all probably experienced that bit of a high that you get when you've been out, especially if you go out on, say, a cold, wet morning, and you come back in again, have a shower. You feel quite good, don't you? You feel quite good with yourself. What other things?
I don't know, just guessing how it's removing weight off the body through the sweat.
Helps you losing weight.
Body weight through the sweat.
So it does help, it does make you sweat, and it does help you lose, it's probably not through losing the sweat, but yes, indeed, in terms of when you sweat, you know you're at an activity level where you're getting rid of the calories. Yeah, so they're definitely linked. Anything else? Any other things? Should we have a look and see what's on my list? So yeah, feel stronger. Heart health, so cardiovascular disease risk. Quality of life. So linked in with feeling better, wanting to get out, do more, meet more people. Blood pressure control. So this was a big one that John mentioned, wasn't it? So we know that exercise helps to lower your blood pressure. Chronic exercise use does. Diabetes control as well. Okay. Mental health, bone density, help to control your cholesterol, reduce breathlessness, and then, yeah, weight control. A couple of people mentioned that. And that brings me on to this. Has everybody seen the energy balance before? Yeah. So if you're at the top there, you're in weight maintenance, you've got weight gain and weight loss, and it's all to do, isn't it, with how much food you take in and how much energy expenditure you take out the other side, so how much activity you do. And it's about balancing those two things that helps you maintain your weight. But if you want to lose weight, and we know that losing weight is if you are overweight, it's a good thing to lose some weight. It's good for your kidneys, it's good for your heart, it's good for your muscles. So if you want to lose some weight, you've got to shift that balance. You've got to eat less and you've got to move more. Okay, what's difficult about starting to do exercise? I'm sure this must be one that everybody's got lots of things to say on. Lack of time, absolutely. So I have people who come to see me who go on dialysis 3 times a week, and then we're trying to get them to fit in exercise around that. So it's quite difficult, and you've got lots of things going on. What else? Confidence, yeah. Yeah, absolutely. So confidence with where to start. Is it okay? But also, if somebody's telling you to go in a gym full of people you don't know, takes a little bit of confidence, doesn't it, to go in that sort of environment. What else?
When you first start, it's hard work.
Yeah, it's hard work.
It's not fun.
It's not fun, no. It's the feeling afterwards that's good, but yeah, it's not fun at the time. Although you can make it fun while you're doing it, but no, I know. I don't think if anybody says exercise, what's your favourite thing to do? Not many people put their hand up and say exercise. Yes?
For me, it's coping with the recovery time. It takes me a long time to recover. I feel okay. I get that high after I finish
knocked out. Yeah, yeah.
Still destroyed now after yesterday morning.
Yeah, so fatigue. So, yeah, absolutely.
And then you've got to do it again.
Yeah, yeah,
So you spend your whole life being tired.
yeah,
If you don't exercise, if you didn't exercise, oh, I'm not tired.
yeah. So if you don't exercise, you don't feel tired. Okay, okay. So,
Hopefully trying to change this,
yeah,
sort of build up some endurance and
yes,
stamina.
absolutely, yeah. But it might be worth, again, it might be worth looking at what you're doing, and that might be something to do on an individual basis, to look at how shouldn't feel tired all the time with it. So, anything else?
Feel lazy.
Feel lazy? Yeah, yeah. Takes motivation, doesn't it? I don't think there is anybody, maybe some of our elite athletes, that get out of bed and go, I want to exercise. I don't think anybody does that. So, yeah, it takes motivation. Yeah,
If you decide to join a gym, it can be expensive.
absolutely. Yeah, yeah. It's difficult, isn't it? Facilities. So you either go to a gym, you go outside. What happens with outside in this country?
Cold and warm.
Although, I mean, the weather over the summer was absolutely glorious, but then maybe it was too hot to be outside exercising. Yeah. Any other things? Shall we see what some of my patients have come up with? So weight management and fluid. Lots of hospital appointments, so we mentioned time, didn't we? The weather being unpredictable, feeling tired, yeah. What if it makes my kidneys worse? Does anybody here... no, I'm not going to get anybody to put up their hands, but a lot of people come to see me and they say, well, I'm worried about exercising because what happens if it makes my kidney condition worse? And that's quite a common one, and that's natural for us to feel nervous about doing things when we've got a kidney disease. Muscles feeling weak, so like you said, it's hard to start, isn't it? So if you feel weak, where do you get the energy to start and get going? And the side effects of some of the medications as well. So what are the recommendations? Now, we don't have kidney-specific ones as yet because there's lots of research studies that are going on, but we know from the research studies that have been done in exercise and kidney disease that we can say that exercise is safe and that we definitely want you to be doing more of it. But what we do is we go with some of the more general guidelines, and this is the guidelines that I'm going to share with you, which is the Start Active, Stay Active, and this is across the whole of the United Kingdom. So what do these ones say? Okay, so we're just looking at adults. Adults should aim to be active daily, okay? So don't want anybody sitting down during the day. We want you to get up and move around, okay? Over a week, your activity should add up to at least 150 minutes of moderate intensity activity in bouts of 10 minutes or more. Now that can be in anything. That can be gardening, that can be walking, okay? But the research shows that you're looking for that sort of volume of exercise to get the benefits, okay? So all of the things that we've talked about just earlier in terms of the good things about exercise, you get those by doing a good amount of exercise, okay? Or if you can't manage to do this on 5 days of the week or over the week, you can do 75 minutes, so you can do half of that, but you've got to do it at a slightly more intense level, okay? So rather than your gardening, this is looking more at a bit of jogging or going down to the gym and getting your heart rate up so that you're feeling sweaty, okay? Muscle strength activity on at least a couple of days of the week, okay? So this can be just having some weights at home, okay? Doing some, progressive weights with a 1, 2, 3 kg weights. It can be going down the gym, but we know, especially for the bone health, that it's really important to be adding in a couple of days a week where you're doing some strength exercises. And this is showing, some of the recent studies coming out are showing more and more that just not sitting, not being sedentary is really, really important. Okay, so just getting up and moving around is really, really important for our health. Looking at older adults, so adults who are 65 years and over, there's an additional one which is added, and that's to incorporate physical activity that improves balance and coordination on at least a couple of days of the week. And this is especially important in people who are experiencing falls. Okay, and the important thing about this one is you may find lots and lots of information in terms of, okay, stand on one leg, you know, stand both, you know, feet like this. And all of those are really, really good. But there is lots of information out there now and lots of programs which are doing dynamic types of balance activities. And those are really, really good to look out for because very, very few people fall because they're doing this at home. Yeah? They fall because they're reaching to pick something up or they're turning round to do something. So trying to do some dynamic type of balance training is really good on a couple of days a week. Okay, so when thinking about what type of activity is right for you, so we don't all enjoy the same things, do we? Everyone's different. It's part of our variety that makes us all special and makes us all interesting to each other. So we need to have a bit of a think about what type of activity might be right for us on an individual basis. So these are just some questions just to start you thinking about what might be right for you. Okay, so how much time do you have? So if you're somebody that's at work 5 days of the week and is getting up early in the morning and going to bed, you know, coming home exhausted and going to bed, that really limits the amount of time. So you need to find something that you can do, maybe at the weekend, or something you can do in your living room, maybe before you go to work or when you come home. Okay. Are you highly self-motivated? So are you one of these people that can set a plan and say, I'm going to do this and I'm going to do this then, and stick to it? If you are, then, you know, joining something which, you know, is more on an individual basis or going out for a run on your own might be something that suits you. This is a really important one. Is there something particular that you enjoy doing? So it might be something that you did a while back, which you really enjoyed, and you think you might like to start doing again. So I know lots of people that have taken up older football teams. They've enjoyed playing football in their youth and they've gone back to doing some slightly older football playing. Do you like to attend groups? Do you like to exercise with other people? Do you like to have other people that are in the same boat? Or maybe I particularly like exercising where I've got somebody that's doing better than me because it makes me want to exercise as well as they're doing. So that's my motivation. Do you need some help to start exercising? Do you need to, or would you like to be offered something where you go along and get some help from a physio or a trained exercise specialist in terms of giving you some advice? Healthy walks with pedometers. So you've probably all seen, you can get pedometers with just about everything nowadays, okay? And they do vary in terms of how accurate they are, but generally they all do the same thing. The cheap ones, the more expensive ones. So they all give you a bit of motivation to see how much you're doing of something, okay? So if that's what gets you going, pop it on, have a look, set yourself a target, and that's a good thing to do. The other thing is active, healthy lifestyles. Lots of councils run walking groups, and that might be something that you'd like to get involved in. So you can check with your local council for that. The other thing is exercise on referral. Has anyone here been through exercise on referral? Yeah, yeah. So you can go and see your GP, or you can see your physio or your doctor, and you can be prescribed exercise, which is the way I think it should be. Where, you know, it's a good thing. We know it's good for us to get prescribed exercise, and that means that you go to a local centre, and you will be inducted, and you'll be offered a much cheaper rate of attending either a class or a gym program, and you'll get some supervision to start with to get you going, and then it'll be on a more individual basis. So do speak to your doctor if that's something you're interested in. And swimming and cycling, okay, so more individualised activities, but quite often get asked, is it safe? Can I go swimming? Can I cycle? Absolutely, yeah. Some people like exercising at home. We've produced a home exercise diary that our patients do at home, okay, and they can progress through, follow a warm-up and a little bit of an exercise circuit and a cool-down. And some people much prefer doing that. It fits around all of their activities. They don't want to come in and see us and do a class in the hospital. And fitness apps. Who looks on their iPhone? Yeah? Yeah? This is becoming much, much more common. It's brilliant. Does everybody know that they've got, I know not everybody necessarily has an iPhone, but does everybody who does have one know that you can just go onto your health app and it's telling you how many steps you've done? Yeah? Yeah? So it's a really, really good one. You can just keep it on you and you can have a look and see. It tells you how many stairs you've been up and everything else. So these are getting much more used. And this one in the middle is a really, really, really good one, which is your Couch to 5K. Okay, this gives you lots and lots of motivation. It has somebody talking to you and helping you through a program of going from not doing very much to hopefully being able to complete 5Ks. So this is something we run at our hospital. It's a specific renal rehabilitation program, so for patients with chronic kidney disease, but it's based very much on cardiac rehab. So that's something else which is an option if it's something that's available in your hospital. So how do we know if we're exercising at the right level? I think the gentleman at the back had one of the things, which was get a bit hot and a bit sweaty. How do you know in terms of your breathlessness? How would you feel? How do you think you should be feeling? Who on that scale? Where do you think? If I showed you that scale and said,
I'll say
the green one? Yeah, yeah. Colour-coded. So yeah, so we're aiming for somewhat hard. And do you know what somewhat hard, does everybody know what somewhat hard feels like? Because it's personal to everybody. But it feels like you, it sounds like if you were to say a sentence, so if you were to say, I hope this exercise is going to be good for me, you would be able to say the sentence, but you'd have to have some breaths in between. So you'd be, I hope this exercise is going to be good for me. Okay, so that's a really simple way for you to test when you're out walking or you're out doing whatever activity it is that you want to get the benefits from doing, is to say, if I say that sentence, you don't have to necessarily say it out loud in front of a whole load of people, maybe wait until you've gone around the corner, but if you say it out loud, are you breathless in between? If you're not breathless, speed up, add in a hill. We're very clever, our bodies are incredibly clever. They accommodate really, really quickly. So what we might be doing 1 week, 2 weeks later, suddenly we're not feeling that breathless anymore. And that's great because it means we're progressing, but it also means that we have to push the boundary. And that can be through, as I say, going quicker, going for longer, or making it more difficult. So adding in a hill or doing something to make it so that you're more breathless. So now you've decided that you want to do a program, how are you going to stick with it? Because there's lots of things that come into our daily lives, isn't it? So these are just some tips. So support. So doctors and nurses, you know, if you want to do it, talk to whoever you see in clinic or family, friends. Get some support, get some motivation. Tell somebody you're going to the class next week so that you know that they're going to ask you, how was the class? Did you enjoy the class? Okay. Facilities and equipment. Okay, if you want to be somebody who does something at home, you know, go out and get your weights. Okay, do very, very cheap set in Argos. You can get some band. You can do a whole load of things off YouTube. Okay, so that's a really, really simple way of doing it. Really important is for it to be enjoyable. Okay, so find something that to you is going to be enjoyable. And it might not be the thing that your best mate enjoys and is trying to drag you out on. It might mean making a different choice, meeting somebody else that likes the thing that you enjoy doing. Plan. Now this is a really big thing. We plan our food, don't we? So we plan when we're going to go shopping or we're doing the food order, what meals we're going to have in our week. Okay, and that comes quite naturally to us. We need to be doing the same thing with our exercise. So plan ahead, have a look at which days are busy, which days you might feel more tired, and when you're going to try and fit it in. If you can, put it in your diary if you've got a phone. Maybe put an alert on. Move it if it gets, don't take it out, but move it if something comes up where you've got a conflicting arrangement. Really important to look at your progress. So fitness tests are good if you're involved with physios or you're involved with somebody that can do you a fitness test. but also just that, you know, at home, when you're out, you'll be able to notice, see how many steps you've done, see how long it's taken you, whether you can do it in a shorter amount of time. Those are all simple tests you can do to show yourself that you've improved, okay? And if we don't see that we're improving and we're getting the benefits, we lose the motivation, don't we, to want to do things. Okay. So how to minimize the risks of injury from exercise training. So if you're worried, you know, and I will stand up here and say, I've been working with patients for as long as I have done, and it's safe and it's enjoyable. But if you're nervous or you want some extra information, talk to your doctor or your physio, or talk to you know, somebody who's got a background in exercise. Start slowly and progress gradually. I would never say to somebody that's not been doing very much exercise, go out and have a run, okay? Go out, do a walk, progress your walk, start a slow jog, end up in a run. Okay, so slowly progressing. Really important to warm up and cool down. And I'll put alongside that wearing appropriate footwear and appropriate clothing. If you're going to go out and walk outside in this country, you might want to have a light jacket on, but not something that's going to make you too hot. Okay, so really have a think about how you're going to be comfortable and how you're going to be happy when you're out doing whatever it is that you're going to be doing. Most important thing is to remember that not taking part is more of a risk than taking part. Okay, so that's really important. And now with all that information, it's about you deciding whether the benefits and what exercise and adding exercise and physical activity into your day is going to give you, and balance it against the things which are hard and things which are making it difficult to start. And if you can get that balance to tip in favour of that it's going to be a good thing to do, then you're ready to make that change, okay? If it's not there yet, find out that information. Find out if there are things available in your local area. Tip that balance, get ready to change, and then the most important thing is to just make that change, make that first step. So that brings me to the end of my talk. So what we've talked about today is the good things about exercise, why exercise can be difficult, why it's important to maintain a healthy weight, that there's lots and lots of individual options out there. It's a personal choice as to what things we enjoy. It takes motivation, it takes planning, but it is achievable and everybody can exercise. So I'll leave you with that message and say thank you very much. Any questions?
Have you heard about 7 minutes workout? And do you recommend it as well?
Oh, the 7 minutes, did you say the
7 minutes workout.
Yeah. So there's lots of those types of things. You mean like on the YouTube? Or?
Yeah, there's apps and...
Yeah, absolutely. I think, you know, it's one of those things, whatever's going to suit you, do. The only thing I would mention is make sure that you're already at a basic level before you start doing some of those. Some of them are quite rigorous and, you know, they'll start off with jogging as being the first thing you ever do. But as long as, you know, maybe have a look at what it is, and if you feel ready to do that, I think whatever it is that you can do that gets you active, absolutely, brilliant.
Could you say something about exercise post-transplant?
Yeah.
The reason I ask is that prior to my transplant, I was going to the gym 3 times a week and was absolutely fine. Yeah. And when I was allowed in again 4 months after my transplant, I mean, I started off fairly slowly. The first thing I did was a bit of swimming, and I used to do a lot of distance swimming. Okay. And I swam 10 lengths and thought I was dying. And then when I got back into the gym to do cardio work and resistance work, I was pathetic. And it's, you know, it's getting better now, but I couldn't believe how much condition I'd lost in those times. Partly, I think it might be to do with drugs, but it's also to do with lack of doing anything for 4 months, really. So could you say something about getting condition back again?
Yeah, absolutely. So it's really, really important, and once you've had your kidney transplant, to start adding in some exercise quite gradually. what we say, so we work in the kidney transplant clinic in my hospital, and what we generally say is that from 6 weeks to start adding in some activity, not structured exercise, and then, that's straight after your transplant, and then once you get to 6 weeks, we're quite keen for you to start upping that activity, so you're not having quite so long of being inactive. Because you're quite right, it's the inactivity that makes your muscles a little bit smaller and a little bit less strong. In terms of regaining the condition, it is about balancing doing some of those activities against maybe feeling a bit fatigued, and that can be, so some of the medications can make you feel a bit fatigued. They also make you feel a bit hungry, and so some people struggle a little bit with weight gain as well after kidney transplantation. So important to start slowly and progress, but there's no reason why you can't keep adding in and get back to the same level that you were, if not better, than you were pre-kidney transplantation. But you're absolutely right, it'll be the length of time that you've not been in the gym and coupled with some of the medications. And also, did anybody say to you it's okay to exercise after your kidney transplant?
I was told it was okay to go back into the gym when the time came right, but it was just not in terms of exercise after the transplant, but it was people were saying just make sure you're active, make sure you're walking, make sure you're standing a lot and doing those sort of things.
Yeah.
So I wasn't given a lot of guidance as to what I ought to be doing.
Yeah. So I think the really important thing is that it's safe. It's safe and it doesn't harm the kidney. And I think a lot of people get given they have that new kidney and it's very, very precious and people don't want to damage it. So the message is it's safe, gradual, but you should be able to get even better than you were before kidney transplant.
Hello. A few people online are asking about IgA specifically. Are there any specific forms of exercise that you think people with IgA or high proteinuria shouldn't be doing?
So it's not something that's been extensively studied, but there has been a couple of small studies which have been done, which have looked at people doing quite a good amount of activity and seeing the result afterwards in terms of if it's damaging, and haven't shown that it's damaging. So I don't know whether you would agree, John. I would say that exercise is something which is very good and essential. And any type of activity that, again, it's the moderately breathless, it's trying to get to that level to get you the benefits, but there's nothing specific to either avoid or specifically to IgA.
Thank you very much.
Okay. Thank you all very much.